Okay, disorders of the colon and rectum. I'm going to go back here. Okay, so so the large intestines, the last stop on the way out. Okay, so the large intestines, it includes, well, here, let me try to show you. Okay, the large intestines and the small intestines, when they come together, they form kind of a blind pouch. Okay, so here's the small intestines coming in. Here's the large intestines. They don't line up perfectly, so we end up with this pouch here. Food can build up in that pouch and can cause appendicitis. Okay, so the pouch is called the cecum. Okay, the appendix is the little part that sticks off of it. Okay, if food gets stuck in here, it can cause infection, can cause appendicitis. The colon has, well, why don't we have a picture of the small intestine? I don't have a picture of it. Oh well, sorry guys. Sorry. Okay, so here's the appendix. Okay, so we have ascending colon, transverse colon, descending colon, sigmoid colon is on the way out. Okay, the rectum, anal canal. Okay, so the diameter is bigger, but it's shorter. The function of the large intestine is to absorb water. Okay, so we don't have diarrhea. It also absorbs vitamins. Some of the vitamins are actually produced in the small intestines by the bacteria that are found in there, like vitamin B and vitamin K. Okay, and it also is where we form feces. Okay, so there's two sphincters that are going to regulate defecation. So there's an internal sphincter and an external sphincter. The internal is involuntary and the external is voluntary. So the external is the one that you have control over. So if you can control the external, you're going to hold your poop in. But if you can't, then it'll just come out. Once this gets full, there's stretch receptors in there, and it's going to signal that it's time to go. Okay, now disorders. Look at all of them. Okay, so diarrhea. So diarrhea is caused by an infection or nervous stimulation. So like if you're nervous before you take a test or something, the sympathetic nervous system kind of stimulates things to move along. Okay, so that's going to increase peristalsis. The water's not going to be reabsorbed because things are moving too fast, and that's going to cause runny feces. Okay, now we have the opposite, constipation. Okay, so constipation is when the feces are dry and hard. So if you need to go and you hold it, more water is going to be absorbed in your large intestines, and the feces are going to become drier, and it becomes harder to eliminate them. So if you drink enough water, go when you need to go, eat enough fiber, it keeps things moving along. Hemorrhoids. Hemorrhoids are kind of like varicose veins of the blood vessels in the anus. Okay, so they become inflamed, enlarged, the blood vessels do, and it can be caused by chronic constipation if you're pushing really hard to try to poop. Pregnancy puts a lot of pressure on the bottom of your body. Aging, anal intercourse can all cause them. Okay, diverticulosis. So the colon, the mucosa of it, can develop pouches in the muscular layer. Okay, well, okay, you can get pouches in there because you get weak spots in the muscular layer. Okay, and those pouches could get food trapped in them, and it could become inflamed. Okay, IBS is irritable bowel syndrome. So they think it's caused by stress, but what happens is the muscularis layer contracts, kind of causes cramps. Okay, so it's not coordinated the way it's supposed to, and it causes abdominal pain and chronic diarrhea. Inflammatory bowel disease or colitis. Okay, so it's the bowel is inflamed, so the blood vessels are inflamed. They're irritated. So IBD includes disorders like ulcerative colitis or Crohn's disease. Okay, and then there are also polyps and colon cancer. So polyps are just little growths that can occur in the mucosa. Sometimes they're benign, sometimes they can be cancerous. So I gave you like 2 pages worth of stuff in 2 minutes. Okay, now we have to talk about nutrition and weight control. Okay, so let's start this on this set and then we can finish it. Okay, so what is obesity and BMI? So BMI is body mass index. Okay, so when an individual is grossly overweight and has a body mass index of greater than or equal to 30, that's considered obese. The BMI, it's a guide that's used to estimate how much of your body weight is due to adipose tissue. So they take your height, your weight, and they come up with what your body mass index is. Okay, now, one downfall of this is that it doesn't take into account whether you're male or female, how fit you are, what your bone structure is like. Some people are more petite, some people are bigger. Bigger people can carry more weight. Okay, so here's the BMI chart. Okay, so you would go in, you find your weight, find your height, and you could find your where you should be. Okay, why should we be concerned with obesity? Who cares, right? So, obesity, the rate of obesity has doubled in the United States in the last 20 years. Okay, obesity causes problems, causes health problems. So, in the U.S., about 1/3 of adults are obese, and now kids and adolescents are obese. That never used to happen. Obesity tends to increase as we make more money. Okay, now, why is it a problem? It's associated with an increased risk of premature death, adult onset diabetes, which are type 2 diabetes, high blood pressure, cardiovascular disease, stroke, gallbladder disease, respiratory problems, osteoarthritis, and certain cancers. So we need to take care of ourselves. Okay, now, searching for the magic weight loss bullet. Okay, so this is one of the health focus. This is on page 184. Okay, there's all sorts of different things people try. Okay, trendy diet programs. So Pritikin diet. It's high carbs, high fiber. You eat lots of whole grains and vegetables. Okay, it's really, really low fat, but you always need some fats in your diet. Okay, Atkins diet. It's the opposite of the Pritikin. Okay, so it's low carbs, but high protein and it's fat. Okay, the Atkins diet is really hard on the body because we do need carbohydrates. Okay, so, you know, you kind of have to take everything in moderation and exercise. A lot of these are, they can be hard on your body. We're not built to just survive on protein. Okay, we need glucose. It's hard for our body to make glucose, which we need to make ATP from protein. Okay, the Zone and the South Beach diets, those are kind of like the Atkins diets, but they say you should have a healthy amount of fat. Okay, now there are some prescription drugs. Okay, another diet out there right now is the paleo diet. Okay, prescription drugs. Okay, so there's Orlistat. Okay, Orlistat prevents you from absorbing your fat. It can cause lots of diarrhea. Shouldn't giggle, but it would. Okay, and then there's Phentermine. Okay, Phentermine is like fen-phen, the fen-phen. Okay, it's an appetite suppressant, so you don't want to eat. Okay, but it causes other problems. Okay, now, surgical procedures. So there's different surgeries that that are done nowadays. Gastroplasty. This is if they staple or they kind of partition off a small portion of your stomach, so you can't eat as much food. Gastric bypass. What they do is they're going to take the lower part of your small intestines and attach it to your stomach, So most of the food bypasses the stomach and the small intestines. Okay, gastric banding, like a lap band, they use a band to constrict and reduce the stomach size. And then liposuction, okay, is just removing fat cells. Okay, but if you don't change what you're doing, these don't help, right? Because you can stretch your stomach back out. Okay, now to understand, whoops, I'm going to stop here because it's getting too long.